It was fantastic. I think it sets the stage beautifully for the rest of the day and to dig deeper into some of these topics as the day goes with various panel discussions and keynotes and masterclasses and what have you. Maybe this is a great opportunity. Jeroen spent a lot of time talking about artificial intelligence. I'll take that opportunity or cue to remind you about the masterclass at 4 o'clock. It is artificial intelligence from lab to production. Do not miss that. Some of what Jeroen spoke of, you should probably see in flesh and blood in some form and shape in that masterclass as well. So do take advantage of that. The second thing is, of course, you can once again hear Jeroen and his insights, deep insights at 4 o'clock in his own masterclass. Solutions in healthcare, so please do take advantage of that as well. And he also mentioned about community life centers and how that can be used to really take care to the last mile, how to sort of overcome the challenge of access to care. And lo and behold, there is a showcase booth right outside between 12 and 2. Do visit that booth. A lot of the solutions that Philips is taking to market, taking to the patient, taking to the customers in that space is showcased there. So do try and take advantage of that as well. Now, this now gives me the opportunity to call upon and invite our guest of honor today, Dr. RANJAN SHETTY, to take the stage and really share his insights. Dr. RANJAN SHETTY is head of cardiology at the Manipal group of hospitals. He's one of the most revered cardiologists in the country. He currently heads the cardiology department, as I said, in the Manipal group of hospitals. He has been a fellow at the American College of Cardiology and European Society of Cardiology. He was nominated as the best house physician at AIIMS and received the honor from the then President of India, Dr. APJ Abdul Kalam. Has more than 50 publications in national and international publications and has presented papers at various national and international conferences. With that, Dr. RANJAN SHETTY.
This is not my normal voice. So coming back to Philips is always a pleasure. I've been associated with Philips now for more than a decade. Initially, I used to work in KMC Manipal, which is our university college, and I've associated with most of you. There are so many familiar faces. It's always good to be here. So we know that as I'm here more as a consumer or one of the beneficiaries of Philips innovation and Philips healthcare. So I'm just going to tell the insights, the way we look at health, the innovation and way we can take it to people. Now, healthcare for us is, that's our bread and butter, and that's what we figure in. But what about healthcare? The biggest problem is the paradox. I'm sure both the previous speakers did speak about the paradox in healthcare, where there is rural, there is urban, and how do we, close this gap? How do we take healthcare everywhere? So what keeps us thinking all the time is, what's important to healthcare? Is it taking a simple medicine like, say, aspirin, which all of you are familiar, to every person in the world, say, every person in Africa, every person in Asia, or is it inventing a very new antiplatelet? We do have them. There are new ones which are called ticagrelor, which are much better. When you say much better, it is 1% better than aspirin, but comes at a much higher price, and definitely it doesn't reach to everybody. It's in the small population. So what do we need? That is a question which we keep asking us every time. Probably the answer is very simple. Answer is bit of both. You can't have just aspirin going everywhere. That may not be enough. It may not save all the life. But you can't be spending all your money now on innovating a new drug which is marginally better. That's where we are in healthcare. How much ever we talk, in last couple of decades, we have read a lot. To save one extra life now, you have to spend much more, the millions of dollars spent is much higher. So that delta change which you are trying to produce at high end is much expensive. And all of you know that money is limited now in the world, not just in healthcare, but everywhere. It's just it's limited financial state. So we need to be very wise in where we spend our money. So what I request to most, to top minds who are constantly thinking about it, we need to think of both. First, how to make aspirin available to everyone. Can any healthcare solution do that? And simultaneously think of innovation where we do something good and make sure it reaches everywhere. We did talk about comprehensive healthcare because healthcare is not medical care. It definitely goes beyond medical care, and the previous speakers did speak about it. For example, look at the current problem. I work in Manipal hospital and beds are full. The reason being, say around 40% of patients right now are dengue patients. Now you look at the dengue problem. The mosquito can actually fly only 100 meters. It can't fly more than that. So whoever has got a dengue, the mosquito is been there in 100 meters around his house or workspace. So when we talk about healthcare, we need to tackle that. Is there a way we could tackle that mosquito then thereby? I mean, I'm sure we could put it on BBMP or the government official, but is there something which technology can do to prevent the mosquito, prevent the dengue at the source? Is there somewhere we make sure there is no stagnation, there is no it's all artificially collected water. The rapid urbanization is the reason for all that, and it's all artificially collected. If there is somewhere, we need solutions even at that front. And unfortunately, some of these diseases like dengue, there is a lot of immune reaction which comes in. So younger, healthier people are hit the most because it's not just the virus, it's the way you respond to this virus. So hence there is loss of life lost. So what I'm trying to tell here is it has to be comprehensive, and since it has to be comprehensive, it should involve multiple aspects. We do talk about healthy lifestyle, but we also need to make sure our environment around us is also very healthy to prevent some of these communicable diseases. When we come to non-communicable disease, especially innovation, I'm sure we are heading very fast. One more thing as doctors, what we always feel is, sometimes there are solutions which already exist, but we are not aware of it. That's the problem which we do feel. For example, I'm a cardiologist, and what interests me the most in the previous speech was the cath lab in the mall. So I would like to work there sometime if there is a cath lab in the mall. Yeah. So what worries us is, like, look at your smartphone, Nobody actually tells you, nobody tells you what are the options, but you sit with that and you figure out some of the interesting options which are available. But can we do it with a cath lab? We can't do it. There is an instruction guide which comes. There are people who come in the beginning and tell us these are the features. And these are service feature of the people who are not really the product or not really the people who are involved in the innovation. We were part of your beta site in KMC Manipal, hence I'm very sure you have so much more which is already hidden in the mission, but we don't know that it is hidden. These are not the mission we play around. You don't want to. There is radiation, there are expensive missions. So we do not play around with this mission like your smartphones. So there is a need to communicate the features you have. I had come last time to, I think, your CV100 mission, the extreme ultrasound mission which you released in India. I was there when we released it. I realized there were so many features which are already there, and these were the features which I always wanted but didn't know it existed in the current mission. And so it's also important for us to, as we keep innovating new things, it's also important for us to make sure whatever we have innovated, we tell right people. There's a big knowledge gap. The person who comes to us is not the person who has, made it. He may not be convinced because he doesn't understand, he doesn't have a passion to tell us. So there must be a way that production engineer or somebody who's involved actually interacts with the end customer like us and tells us these are the features I have made. And one more thing which we always find is we do get lots of solution for problems which don't exist. Sometimes you think this is a problem, but we may not even think that is a problem at all. It may be a very simple thing, but we could have a lot of expensive solutions which are available. So it's also important that we communicate a lot, bring down the gap, and you understand from us what are our problems, and try to find a solution to that. That could help a lot. We have had, there are new stents which came up in cardiology. They were much more expensive, which were there, but there was no need. They thought it's difficult for us to take the previous one, but then it was not a problem which existed. So please focus on your innovation to the problem which exists, and communicate, talk to us, talk to the end product, and the research sometimes has to go from this direction, from the need to solution, may not be from solution to need. Sometimes we do search for a need because we have a solution that may not exist. So, but having involved with Philips for more than a decade, I've seen lots of things change. I'm very happy with the way the Philips itself has grown in last 1 decade. It's extremely difficult for us to predict a future, as we discussed. If you ask me, how do I see cardiology in next 5 years? I may not be able to tell. Even cardiology, which is my area, forget other specialties in medicine, it may not be tell. Whatever I think would actually come in next 1 year, what I think will come in 5 years, would actually come in next 1 to 2 years. It's very difficult for us to think future. So I'm sure we all should keep open mind and understand where it goes. One of our very senior ophthalmologists, he was telling me, he was in a lecture, this was some 20 years back, and people asked, how do you see ophthalmology at that time? And whatever they predicted, there would be lasers, that would be, that was the time when none of them existed, and all were there in 1 to 2 years. Other than, I think, flying car, almost all innovations have come much before their time, so it's very difficult for us to predict. What I really like is taking technology to rural people, and as we discussed, there is cardiac robotics available now, which has just been launched. I'm sure that's a very exciting area which I am personally looking at too. So what could happen with that is, now angioplasty, we go in, we scrub, there is radiation, we pass wire, all of you know what we do. Now we could do it outside the room. It could be there, everything covered. I don't need to use lead. There's absolutely no radiation. I could sit out and do it. I'm hoping there will be a day I can do it on my iPhone, and the patient would be right now in Manipal hospital here, or 300 to 400 kilometers in the other Manipal which I worked. There is already a telerobotics which is already available even in field of cardiology. There are also robotics which are there in many other fields. I'm sure that is something which we are very excited about, where the top care, which is now available in the metros, could actually be available in any city possible, and people need not travel. There's also other problem. There was one district commissioner who was discussing, he was just talking about maternal mortality. That's something which we should never have in current era. It has to be very least. And he was telling me, when he actually worked around it, what really helped was better roads rather than anything else. Sometimes we talk about taking technology, but there is also a way that we could make people come to us without investing too much, by having good, the transport system. So there's so much more to healthcare than just what we doctors do. Part of it is actually, there's a considerable amount which still is with the government now. I'm sure they're taking a lot of steps, and we could change a lot. What is worrying now is actually the hurdles. We do have a lot of hurdles. It's not an easy time, It looks easy for healthcare, but it's not a very easy time for healthcare as we see it. With lots of schemes coming out, there is a need to do lots of things at a much lower price, which could compromise quality. That's what is the worry, is that balance becomes very important. So when you innovate a lot of new, say, cath labs, new machines, it's possible that people are not ready to buy it. Because if you are treating, see this, the government prescribed schemes, there's only so much extra money you have. You do have a lot of numbers, but there's only so much extra money you have. So it's possible that you compromise on the missionaries. So sometimes that, if you ask me, is the biggest hurdle to innovation. Obviously we need innovation, that could be a biggest hurdle. Other is the patient mentality. That itself is a very big hurdle. Just because I have a fantastic new cath lab versus a simple cath lab, the patient is not ready to pay more for that compared to what he would pay otherwise. For him, procedure is a procedure, so that additional extra benefit, they're not able to understand at right point, especially in India. I'm sure in Western world it would be different, but there the problem is that now the insurance companies are so strong, they decide what treatment you get. It's not the patient, it's not the doctor, it's the insurance company which now decides this is the treatment you're going to get, whether you need it or no. So, but here people are ready to buy huge houses, big cars, but when it comes to healthcare, they're ready to, this is the amount they're ready to spend. It's not about what they can afford. This is what healthcare deserves. That is what is there in their mind. And that is a big hurdle. We need to work around them and make them understand that this extra technology is going to, help you. It's healthcare is not a luxury item, but still you need to make them understand that this is the extra price you are paying is this much. Medical doctors himself, there is a lot of resistance. Not everybody is very open to technology. Yes, most of them are now okay with their smartphones and they're okay to watch WhatsApp videos, but when it comes to the real technology where they have to use lots of machines or when you have to automate lots of prescription, they're not very comfortable. There is lots of, reservation here, and there are legal hurdles. Like, for example, the one we discussed. What if I sit here and do a surgery for somebody 300 kilometers and God forbid there is a problem? What does the law say? Is it allowed for me to do that now? There was a High Court judgment which clearly eliminated all telephonic and all you can be penalized for giving a telephonic advice or a WhatsApp advice. You can be penalized, and it is a High Court order. After that, we were very active earlier. Now we are all much more defensive. Maybe rightly so, because you don't have all the information right now. For me, when a person calls me up and tells, I am this patient, I have this problem, it's impossible for me to recollect the whole problem he has. I might end up telling a drug which he may be allergic to without knowing, because I've not seen him, I can't recollect, and I may be busy doing something. So these are the issues which have come up. So although we could do, the legal hurdle is one more thing which we could be facing, and I think as Philips and as innovation experts, you may have to tackle it simultaneously. You get a solution and now it is not allowed, it becomes very difficult for us to see. And everything is going to be capped, there is no doubt about. Most of your machines which are selling at certain price will be reduced, and people may not be able to buy. The government might just cap off the price. So these are some of the hurdles which we are really facing in healthcare. So this is something which which is little worrying, but India has been always a country of huge population, and population itself is being our strength. We could probably overcome some of this. Just to give an example, when stent got capped in India, they were all made 30,000 rupees equal to this. There was lots of worry. Since I'm cardiologist, I do know the worry. There was worry in industry that they would stop all academic activity. There was worry among doctors that we may not get the new stents and our patient may not benefit. There was also worry they would go to Nepal and Bangladesh to get it done at that particular time. But now it's been 2.5 years, I can tell you, none of the worries are actually true. Nothing happened, everybody is okay. There's a new equilibrium which is set in now, and it works fine for everybody. But these are the, but I would also like to tell you, one of the company among the multiple stent companies, see, most of them started laying off people because they were worried they couldn't make. But one of them didn't do that. I wouldn't name the company, but just as an example, one of them really didn't do it. They just took it head on, made more business. They increased their percent share. When I talked to their country head, he says, I took the right decision at that time. So we could be facing some hurdles. Probably at that time, laying off people may not be the solution to those problems. It is probably to work around it and increase your share. That is probably the best way to do it. So AI is something which we are all excited. We need it. There are oncological Watson solutions which are now available for many hospitals. I'm sure in cardiology, just other than robotic, lots of AI solution is what we are, we might need it, and we are really excited about that. So thank you for giving me a chance, and I'm very happy to be here.
So much. Thank you so much, Dr. Shetty. If you can stay on stage for 1 more minute, I would like to request Mr. Sean Carney, Head of Philips Design, to hand over a token of appreciation to Dr. Shetty.
Thank you, man. Thank you.
Thank you, Sean.